Relationships and Borderline Personality Disorder, BPD, Challenges in Friendships and Work Relationships. Individuals with borderline personality disorder, BPD, often face significant challenges in maintaining stable and healthy relationships, not only in romantic and family settings but also in friendships and work relationships. The intense emotions, fear of abandonment, difficulty with trust, and emotional instability characteristic of BPD can create complications in these social and professional settings. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the unique challenges faced by individuals with BPD in their friendships and work relationships, how these challenges manifest, and strategies for improving these relationships and fostering healthier interactions. Challenges and friendships for individuals with BPD. Friendships are vital for emotional support and personal growth, but for individuals with BPD, these relationships can often be fraught with tension, misunderstanding, and emotional volatility. The same emotional dysregulation that complicates romantic relationships can create obstacles in friendships, where mutual understanding, trust, and communication are essential. Here are some of the key challenges in friendships for individuals with BPD. 1. Intense fear of abandonment. A core feature of BPD is the intense fear of abandonment, which can be triggered by real or perceived signs of rejection. In friendships, this fear can lead to clingy or needy behavior, where the person with BPD may excessively seek reassurance or attention from their friends. Over-attachment. The individual with BPD may become overly dependent on their friend for emotional support, leading to feelings of emotional exhaustion or resentment in the friend. This dependency can create an unbalanced dynamic in the friendship. Testing behavior. People with BPD may test their friends by pushing them away or engaging in dramatic behavior to see if the friend will stay, leading to unpredictability and emotional distress in the relationship. 2. Difficulty with boundaries. Boundary setting is often challenging for individuals with BPD, both in terms of respecting others' boundaries and maintaining their own. They may struggle with the balance between closeness and independence, which is essential in healthy friendships. Invasive behaviors. Friends of individuals with BPD may feel overwhelmed by constant emotional demands, whether through frequent texting, calls for reassurance, or expectations for immediate emotional responses. Fear of rejection. The person with BPD may also have difficulty setting personal boundaries because they fear that asserting their needs might drive people away. This can lead to feelings of resentment or emotional burnout for both parties. 3. Idealization and devaluation. Splitting. Similar to romantic relationships, individuals with BPD may idealize their friends one moment and devalue them the next. This cycle of idealization and devaluation, known as splitting, can create instability and confusion in friendships. Emotional volatility. A small mistake or miscommunication can trigger intense feelings of betrayal or anger, leading the individual with BPD to suddenly view their friend as all bad. This shift can feel hurtful and confusing to the friend, especially if they were previously idealized. Strain on trust. The constant emotional ups and downs in the friendship can make it difficult for the friend to trust the stability of the relationship, leading to emotional distance or withdrawal. 4. Difficulty with communication. Communication can be strained in friendships with individuals with BPD, particularly when emotions become overwhelming. The person with BPD may have difficulty expressing themselves clearly or may react impulsively during disagreements. Emotional outbursts. When feeling misunderstood or emotionally triggered, the person with BPD may react with anger, withdrawal, or tearfulness. This can create a cycle of miscommunication, where friends feel frustrated or confused by the intensity of the person's emotions. 5. Feeling unstable or on edge. Friends of individuals with BPD often report feeling like they are walking on eggshells, constantly trying to avoid triggering intense emotional reactions. The emotional volatility can make the friendship feel unstable or unpredictable. Uncertainty in the relationship. Friends may not know what to expect from day to day, which can lead to feelings of anxiety, frustration, or emotional fatigue. Challenges in work relationships for individuals with BPD. In the workplace, the challenges posed by borderline personality disorder can manifest in a variety of ways. The workplace environment requires individuals to manage stress, collaborate with colleagues, and adhere to professional boundaries, all of which can be particularly difficult for someone with BPD. Below are the key challenges that individuals with BPD often face in work relationships. 1. Emotional instability and impulsivity. Emotional dysregulation can lead to impulsive decisions or emotional outbursts in the workplace, especially in response to stress, feedback, or interpersonal conflict. The intense emotions experienced by someone with BPD can result in poor judgment or behavior that undermines their professional relationships. Impulsive actions. Individuals with BPD may act on anger or frustration without thinking through the consequences, which could result in conflicts with colleagues or supervisors. For example, they might make snap decisions or lash out at others in stressful situations. Mood swings. Extreme mood swings can interfere with professional functioning, leading to periods of high productivity followed by emotional exhaustion or withdrawal. 2. Fear of rejection or criticism. The fear of rejection and criticism that individuals with BPD experience can be heightened in the workplace. They may take even neutral feedback as a personal attack, leading to emotional reactions that can strain relationships with coworkers or supervisors. Overreaction to criticism. A single comment from a colleague or manager may trigger an intense emotional response, such as anger, embarrassment, or self-doubt. These reactions can affect their professional demeanor and create tension in the workplace. Sensitivity to perceived slights. The individual with BPD may be hypervigilant to signs of rejection, interpreting neutral comments or actions as personal attacks. 3. Difficulty with authority figures. Many individuals with BPD struggle with authority figures, including bosses or supervisors, due to a mix of fear of rejection, disrespect for perceived authority, or transference of unresolved childhood issues with caregivers. These struggles can lead to conflicts or misunderstandings in work relationships. Conflict with supervisors. The person with BPD may experience difficulty accepting constructive criticism or guidance, viewing it as a threat to their sense of self-worth. This can result in defensiveness, withdrawal, or even open conflict with supervisors. Intense reactions to feedback. A fear of rejection can make even minor work-related feedback feel like a personal rejection, leading to emotional volatility. 4. Difficulty maintaining professional boundaries. Individuals with BPD often have difficulty setting and maintaining boundaries, both personal and professional. In the workplace, this can lead to boundary violations, such as becoming overly involved in co-workers' personal lives or expecting too much emotional support from colleagues. Inappropriate emotional demands. They may expect co-workers to provide emotional validation or support beyond professional expectations, which can cause strain in work relationships. Difficulty with objectivity. The person with BPD may struggle to maintain an appropriate level of detachment from work conflicts or emotional situations, which can blur professional boundaries and affect their ability to perform effectively. 5. Unpredictability in relationships with colleagues. As with friendships, individuals with BPD often experience idealization and evaluation in their relationships with co-workers. Colleagues may be viewed as all good one moment and then all bad the next, depending on the emotional state of the individual with BPD. Shifting attitudes. This can create confusion and discomfort among co-workers, who may feel that their relationship with the person with BPD is unstable and unpredictable. One day they may be seen as the individual's closest ally, and the next they may be treated with anger or resentment. Difficulty building trust. The erratic nature of the relationship makes it difficult for co-workers to form a stable, trusting relationship with the person with BPD. Strategies for improving friendships and work relationships. While BPD can make friendships and work relationships more challenging, there are several strategies that both individuals with BPD and their loved ones or co-workers can use to improve communication, reduce emotional volatility, and foster healthier relationships. 1. Therapy and treatment. Dialectical behavior therapy, DBT, is one of the most effective treatments for BPD, helping individuals learn emotion regulation, distress tolerance, and interpersonal effectiveness. Through therapy, individuals with BPD can develop skills to manage intense emotions and improve their interactions with friends and colleagues. 2. Setting clear boundaries. Learning to set and respect boundaries is essential for improving both personal and professional relationships. This involves understanding and communicating emotional needs and limits in a way that is respectful and considerate of others' boundaries. 3. Open communication. Honest and open communication is key to building trust and resolving conflicts in relationships. For individuals with BPD, being clear about emotional needs and expectations can help avoid misunderstandings and reduce emotional reactivity. 4. Developing coping strategies. Coping strategies such as mindfulness, self-soothing, and distress tolerance techniques can help individuals with BPD manage their emotions more effectively, reducing impulsive behavior and improving their interactions with others. 5. Seeking support. Individuals with BPD and their loved ones or colleagues can benefit from seeking additional support, whether through therapy, support groups, or peer networks. Support systems can provide guidance, encouragement, and a sense of community that helps individuals navigate the challenges of BPD in relationships. Conclusion. Friendships and work relationships can be significantly affected by borderline personality disorder, BPD. The emotional intensity, fear of abandonment, and difficulty with boundaries often lead to instability, conflict, and misunderstanding in these relationships. However, with the right tools, such as therapy, healthy boundaries, open communication, and emotion regulation strategies, individuals with BPD can work toward more stable, fulfilling connections with both friends and colleagues. In future episodes, we will continue to explore more strategies for improving relationships and managing the emotional challenges of BPD. Stay tuned for further insights into borderline personality disorder and how to navigate its impact on interpersonal dynamics.